Are we live?
We are live.
Seems like it's recording. All right. So this is the short version of the long podcast that AJ and I just did. And essentially, we want to give some bullet points, sort of the Cliff Notes version. And let's start by talking about who AJ is. This is Hyperspeed Radio episode 2. AJ Sobrilsky. Yeah, I don't know what for me to say, but he goes by AJ. He's got his own podcast called The Mountain Athlete. AJ and I go way back, and he has made his way to Bozeman, Montana, Excel Physical Therapy via Flagstaff, and has been around some great athletes. Great athlete himself, ran cross country and track in college, and was chasing and or running with some great runners out in Flagstaff, and now is a mountain athlete specialist, which is kind of cool. Climbers, skiers, runners, trail runners, mountain bike. You also mentioned some other kayakers, really?
Yeah.
That's cool.
It is cool.
And just a really unique population. He has his doctor of physical therapy from Carroll University in Wisconsin. And he did an orthopedic residency out there in Green Bay with some really bright minds out there. He is orthopedic clinical specialist, which is what we call an OCS, which is kind of a big deal. And welcome to the show, my man.
Thanks, man. Great intro. Appreciate it.
Yeah, you're welcome. You deserve it. Actually, AJ stepped away from PT for about a year and a half, and I was super bummed because I really believe in the profession that we have, and what we're trying to do for people. And one of my soldiers was not in the fight, so I'm glad he's back in the fight, doing things the right way.
I will say I didn't fully step away. I still had my hands in it. It was actually kind of nice. I had my hands in where I wanted it, and it allowed me to do it a little bit more in the manner that I was desiring. So, but ultimately stepping away from it, I think, brought me back into it in a much deeper way. So
yeah, it sounds to me like you really freshened yourself up.
Yeah, it was a good it was needed. Yeah.
Okay, so let's get started on this. What does the word overuse injury mean to you?
The word overuse to me means the patient or person, client, athlete was probably underprepared for what they did. And as a result, they exceeded the capacity of shoulder, arm, knee, rotator cuff, patella tendon, Achilles tendon. They exceeded the capacity of that tissue to tolerate the demand they imposed on it. They overcooked it.
Can't say it any better.
Gotcha.
Can't say it any better. Around here, we call that stress testing. So just about every patient gets a lesson on stress testing and work capacity. Yep. What is work capacity to you?
Capacity for me is your body's ability to tolerate the stresses or loads that we impose on it. Capacity is an adaptive and evolving thing. It can go up, it can go down. We can modify it, we can train it, we can work on it. Everybody's capacity is a little different, and there's a lot of factors that are involved in capacity. For some people, it's genetics. For some, it's training age. If you've been running since you were in 6th grade, your capacity in your tissues to tolerate running demands is probably really good. As you get older and older and older, you keep up with it. If you pick it up when you're younger, or we impose these new demands that we don't have a whole lot of experience or exposure to, your capacity might be lower until we continue this gradual exposure and loading to them so that capacity can build. And inevitably, if we're doing it right and we're having fun with things, we're all going to be exceeding our capacity at some point. So it's not don't feel like you're the only person having these pains, issues, reactive responses.
Right. And up there in Bozeman, Montana, what type of patients are you seeing that are routinely underprepared?
Yeah. I'm very fortunate to see a very cool, unique, engaging, very relatable population to myself personally. Most of them are fairly young, fairly active, don't really have any secondary comorbidities, and value their health. A lot of them are um, very, they take that extra step to make sure they're getting good sleep, eating healthy, working out. So a lot of them I have to kind of work on bringing them down to get them to do a little bit less or a little bit more specific for that capacity building than just the general of a lot of something. So I see a lot of, again, as you alluded to, trying to see a lot of climbers, trying to see a lot of runners, trying to see a lot of skiers, see some mountain bike stuff, see some kayaking stuff. So people that are out there pushing the limits, pursuing some big goals and some big activities. So it's been a lot of fun to be able to help them through that experience by sharing those experiences, but also by understanding their experience and by having gone through those experiences with them.
Yeah, because you're out there too.
Right.
So what would you say is your primary goal for treating a person with an overuse injury?
Big goal is to get them to understand what's going on. So conceptualizing that the concept of capacity and load and how those kind of balance. And when we have we go over that capacity, we have those reactive responses or injuries or pains. And then getting them to understand that because our body's adaptable, we can actually modify the loads and then strategically place loads, prescribe loads, implement loads to those tissues, those areas, those structures to make them bigger and better and have more capacity long term. So the goal is obviously to get them to understand that, and then we start loading those tissues, and through those activities or with specific exercises, getting them closer and closer to their desired demands. And then as we get them back there, we want to say, hey, we need to develop a plan for long-term adaptive capacity, as Dr. Tyler Nelson out of Salt Lake City would call it, that we're establishing a plan that we're having this continual growth long-term instead of just staying steady at a capacity and always trying to hang below it, and then having those moments where we would exceed it and then said reactive responses or injuries or ailments. So getting them to understand it and then getting them to understand how they can implement that long-term change or growth.
Yeah, sounds like education and progressive loading.
Yeah. Yep. Absolutely.
Awesome. What does passive modalities fit into that?
Yeah. Great question. Tricky subject. The short answer would be passive modalities are okay as long as we're not instilling a nocebo effect or a negative effect on the patient. So we can use massage, manipulation, dry needling, heat, ultrasound tens in with the least amount is necessary, I think. The minimally effective clinical dose, let's just call it, right? So whatever it takes with those things to get the patient taking the movement or exercise into their own hands is the key. So, if you got to do it a few times, that's fine. If you got to do it a couple more times, it's fine. As long as we're progressing that patient to being more active, more independent, and more owning what they're doing and doing it on their own, I'm personally okay with that. I think that there's a moment in time and a place in time for those. They're not something that should be anchored on, and they shouldn't be the foundation of rehab. But if it helps instill some confidence, helps instill some movement variability and variety and ability in those patients, I'm all for getting them in the gym faster. And if that's what's going to take, then let's try to get you.
Yeah, that's what you said in the longer version that I really liked is that you basically use those modalities as a means to get them in the gym sooner with a little bit more ease.
Yeah. And for, like I said, in the full episode, some people come in and they're like, yeah, I don't think I need that. Show me what to do to make, they believe in that exercise as medicine. Some people, again, to the fault of maybe our profession, the medical community, our whole social realm of medicine is a lot of that fix me, do this to me, poke me, prod me, push me. And again, there's a place for that and people see changes with it, but unlikely that that's going to be the cure all, fix all change to their long-term health and positive improvement in whatever they're desiring to do.
Totally agree. Love it. Is there a time where too much strength is a problem?
Loaded question. I'm going to answer it with a very broad saying the answer is yes and no. Again, I think it's patient specific, patient dependent, activity dependent, activity, oriented. As in general, I don't think anybody would not benefit from being a stronger person or athlete. In that sense, though, there's different kinds of strengths, and I think making sure they have the right kinds of strengths to be the best, person, athlete, client is dependent on what their goals and intentions are. So being strong is great. If you can have too much strength in some facet, but again, you got to have the right amount of strength to compete and do the things you want to do, depending upon what they are.
Got it.
Tough question.
Yeah, it is a tough question.
Lost a few hours this last week thinking about it.
Love it. Okay, main takeaways. Give me 3 things that the prospective patient needs to know about overuse injuries.
Yeah. So overuse injuries, again, big takeaways are your body is adaptable and always evolving. So we can stimulate some adaptive stress on those things. When we think about what that stress means, there's different kinds of stress. There's physical stress, like the exercises we're doing, running, biking, climbing, and the training we're doing. So we're implicating those physical stressors. But we also need to remember that there's internal stressors or internal loads, life stress, sleep, diet, eating habits, all these other little things that can tip those scales one way or the other. And sometimes treating those or implementing changes in those will also help your physical pain, okay? And then long-term, if we want to be healthy, strong, capable people and athletes, the goal is to develop some adaptive capacity, which is going to happen through graded exposure to progressive and gradual loading with big, heavy things. So to be strong and more resilient, you got to play offense. You got to make it harder to kill.
Right.
You got to move heavy stuff around and
Right.
be stronger, better, more capable human. And that's probably going to help you in your activity, but also long-term health-wise, mentally and physically.
Beautiful. Last thing, I'm going to ask all my guests this music question. Everybody knows I'm into music. What up there in a big cold Bozeman, Montana, what would you say floating through your ears up there? What are you listening to?
Yeah, right now the thing that's been kind of popping up most recently is Big Wild Radio on Spotify. Big Wild
Radio.
I want you to throw it on today and
I'm
give it a little
listen to
listen.
it today.
You'll be hopping around. I think you'll like it. You got enough eclectic taste.
Right on.
Got it. Yeah.
Big Wild.
And I'll throw it back to Taylor Swift and a little, this here and there.
Spice Girls.
There's a time and place for everything. And Tiger Woods doesn't hit every shot with the driver, okay?
That's right. That's right. Well, AJ, thanks for coming, man. Appreciate it.
Thank you.
The long audio version is really, really good. I'm excited for people to listen to that. And I don't forget to check out Mountain Man podcast.
Mountain Athlete Podcast.
The Mountain Man Athlete Podcast.
You got it.
Appreciate it. Thanks for coming on and have a great
Las
day.
Vegas Running Summit 2022.
Hey, we'll figure something out.
We'll fill the Caesars or whatever the big place is down there. Clearly,
we got some big places now. We got the Golden Knights and the Raiders, and
nice.
we got some big places to fill.
Bottle service on.
But I think between the two of us, we can get some pretty cool people to come out.
Yeah, even if it's just us hanging out and racking our brains.
Yeah.
Get better
too.
Yeah, man. Thanks a bunch.
Appreciate it.
See you later.
Appreciate it.